Yesterday it was World Sleep Day, and this year the theme was quality sleep, sound mind, and happy world. So, sleep is extremely important for our health. And why it is important? Because there are lots of studies which suggest that if you have good sleep, then there is less mortality, less chance of different types of metabolic syndrome, including diabetes, hypertension, coronary heart disease, or some mental behavioral diseases, including depression. So, we need to have a very good sleep so that we can prevent these all diseases. So it is important to understand whether my sleep is good or bad. So it is not only the quantity that matters, the quality is extremely important. And for that, there is a very good questionnaire by which we can assess whether I have a good sleep or bad sleep. So that questionnaire is SATED questionnaire. What is that SATED questionnaire? SATED questionnaire. S for satisfaction, A for alertness, T for timing, E for efficiency, and finally D is duration. So what is satisfaction? So this first question is, are you satisfied with your sleep? So if it is always, then it signifies good sleep. So first question is, are you satisfied with your sleep? If it is always, then the score is 2, that means full marks. If it is sometimes, then it is 1 marks, and if it is rarely or never I am satisfied with my sleep, then it is 0 marks. So this is the first question. Second question, regarding the alertness, A for alertness. So the question is, do you stay awake all day without dozing? So if it is yes, that means always I am staying awake without dodging. So not like this, never. So if then it is 2 marks. That signifies I am going to score a high marks, full marks rather. So I have a good sleep. If it is sometimes, then it is 1, and if it is rare, that means many times I am dozing. So there is a issue regarding with my awake status in the daytime. So that is very critical question. So we need to ask ourselves. Next, the third question is timing. T for timing. So timing means there is a specific question that are you asleep or trying to sleep? Either it is asleep or trying to sleep between 2 a.m. to 4 a.m. So they are specifying between these two time, 2 a.m. to 4 a.m. So if I am asleep or trying to asleep, if it is always there, always is the answer, then I have full marks. That means 2. But if it is sometimes, that means someday I have some duty, I have some work, some office job, then it is 1. So I am not getting the full marks, 100% mark, I am getting the 50% mark here. And if it is never, that means my sleeping pattern is completely different I am generally sleeping at daytime, then I am getting a big 0 regarding that time. So this is very important to sleep at night, and this question is very critical to understand the sleep health. Next, the fourth question is efficiency. So efficiency is again a very important part, and how we can assess this efficiency of sleep. So the question is, do you spend less than 30 minutes awake at night? So this includes the time it takes fall asleep and the awakening from sleep. So if it is always, the answer is always, then I am getting the 100% marks. Full marks is 2. But if it is sometimes, so there is sometimes I have problem, I need to be awake more than 30 minutes at night. It could be initially when I went to bed, and from went to bed to fall asleep. So in between it could be 15 minutes. Again in between when I am sleeping, maybe at 1 a.m. I got up due to some reason, and then I am not feeling sleepy. So I am trying, but I am not getting my sleep. Then it is maybe after 20 minutes I got again I fall asleep. So that means initially it was 15 minutes, then now it is 20 minutes, then I could be awake maybe 8 a.m. like that. But I have crossed that 30 minutes mark, that 30 minutes cutoff. And if it is occurring, then I am getting bad marks in my sleep health questionnaire. So again, the efficiency is very important. And finally, the D, that means the duration. Why duration is important? Because of the obviously the quantity. So the question is, do you sleep between 6 and 8 hours per day? So 6 to 8 hours, that is very critical, and we should follow that. Anything below 6 is bad. Anything more than 8 for a adult male or female is not desirable also. So 6 to 8 is the optimum duration of sleep. And if it is always I am sleeping with that duration 6 to 8, so I am getting full marks, 100 marks. If it is sometimes, then 50% mark. And if it is never, so it could be every day I am sleeping for 5 hours, or every day I am sleeping for 9 hours or 10 hours, then I am getting a big 0. So each question, each 5 question carries 10 marks. Now you can assess your sleep health just revisiting what I had told you, or you can search in the net that SATED questionnaire, SATED questionnaire, to assess your sleep health. And you can answer, you can get, if you get 10 marks out of 10, that 10 is the full marks, so you have a good sleep health. And if it is near 0, so you need to consult your doctor regarding your poor sleep health. Why? Because already we had mentioned, poor sleep health means there is some genetic, epigenetic, molecular and cellular processes that is going on in your system, and that cause some inflammation, sympathetic nervous system activation, different problematic hormonal response, and also in the brain, the neural circuit, there is some problem, issue. So you need to contact your doctor to correct that bad sleep health. And with that, I just want to emphasize again the traditional sleeping pattern of us means Indians, because we Indians are really fortunate. Why? Because our ancestors had told us to sleep early and to get up early. And that is actually our circadian rhythm. So we need to follow the regular circadian rhythm. So any deviation from circadian rhythm is going to create different problems, starting from heart disease to metabolic disease like diabetes, to different types of neural problems, psychiatric illness, suicidal tendencies, and also this bad sleep health can cause different types of cancer also. Obesity, the recent obesity pandemic, what we had faced is hugely responsible. This is due to this bad sleep health. So we need to take care of our sleep health also. Thank you.